Hi, I'm Beth Battolino, CEO of Healthy Women. Thank you for joining us today on Healthy Women's first talk show, WomenTalk.
Hello, and welcome to WomenTalk. I'm Beth Battolino, CEO of Healthy Women and your host of WomenTalk. We've partnered with the National Association of Nurse Practitioners in Women's Health to bring you 3 episodes on the important role nurse practitioners play in women's health, from contraceptive care and maternal health to menopause. In the second episode in our series, we're going to discuss the importance of having access to prenatal and postpartum care and how to advocate for yourself. We have a very special guest to lead this conversation, Dr. Komkwuan Paruchabutr. Komkwuan is an Army Nurse Corps combat veteran. She holds triple board certifications as a family nurse practitioner, a women's health nurse practitioner, and a certified nurse midwife. Thank you, Komkwuan, for joining me for this important conversation about maternal health. And I just need to say, I just love the cadence of your degrees, like how well, it's like a jigsaw puzzle and they fit so well together. And I'm going to kick it off with our first question on why. How did you decide to become a family practitioner and then decide to roll that into a nurse practitioner in women's health? And then after getting the nurse practitioner in women's health, what made you decide to get your degree as a certified nurse midwife?
Well, thanks so much, Beth, for having me on the show. I'm so excited to be here. And that's a great question. I started off my nursing career in trauma and critical care and not even having an idea that I would even end up in women's health at all. And I went back to school and received my master's at UNC Chapel Hill. And it happened to be a dual master's program. You could have opted to do a dual master's for a family nurse practitioner and women's health NP. So I ended up starting off in the FNP program and deciding I wanted to do a dual because I really liked my clinical setting and treating women and seeing women in the clinical environment. And then after that, I took both board certifications and realized that, women's health was my passion. And this is really the only area I wanted to work in. So I was hired in an OBGYN department and I saw patients, day in and day out, and I loved it. It was a great experience. But I really wanted the birthing experience and seeing birthing people. So I went back to school for a postmaster's in midwifery and really just have been in this women's health realm this entire time. So that's really like the trajectory of my career thus far. And it's been great so far. I've enjoyed every minute of it.
Oh, well, I can't say enough about women's health. And I just loved hearing your story because I do think it just mixes so well. And so nurse practitioners in women's health are so lucky to have you as part of their team. So my second question is, we're seeing more and more nurse practitioners in traditional, what we would say would be more traditional OBGYN settings and at hospitals. Can you tell our audience about the changing role of nurse practitioners, particularly nurse practitioners in women's health, as they take care of women in their antepartum, after they have their babies and their families, before, during, and after childbirth?
Sure, of course. So I really don't think the role has really changed as much, especially for women's health nurse practitioners. I just think that there's been more awareness of women's health nurse practitioners. Our role, especially as women's health nurse practitioners, we've always played a significant role and continue to play the significant role in these OBGYN settings and hospital settings as well. It just wasn't really well known. And particularly in the care of birthing people, their babies and the families, most patients and employers really were not as aware. And I think the awareness has really been picking up, which is why I think people think it's a changing role, but but not necessarily changing per se. So this really reflects this broader trend in healthcare where this, there's this awareness, and women's health MPs are, utilizing their degree to the fullest extent, right? And they have advanced training, experience, and there's this growing demand for a comprehensive and person-centered care. They can really, so what can women's health MPs really do when they evaluate patients, especially in a, birth setting? So we can conduct initial and ongoing prenatal care assessments. They evaluate your health history, which is one of the largest roles I feel that we do, because most of us walk around on day-to-day life. We don't recognize health risks and things that are going on with our bodies, and what we are potentially at risk for. And our training, we are trained to really go over with like an eagle eye view of your health history, and not just your health history, but also other factors that can play into your health that can put you at risk for other things. So I think the history is one of the most important parts. And then we do the physical exams, we interpret lab tests, we perform ultrasounds, we, interpret all the ultrasound findings, monitor fetal growth rate, monitor development, education and counseling. It's just a whole wide range. But I think what most people don't know, especially with women's health nurse practitioners, we're really also employed in maternal fetal medicine offices. So high-risk pregnancy physicians, which are maternal fetal medicine specialists, we are employed in these settings as well, seeing in the antepartum phase high-risk pregnancies. And then we also coordinate with obstetricians, maternal fetal medicines specialists, midwives, family medicine. So it's really a comprehensive and total healthcare experience that we're evaluating throughout the course of their pregnancy, but also before their pregnancy and also afterwards as well.
I think it's so important. And I could not agree with you more. I think it's becoming, there's more awareness about nurse practitioners now. I think they've always been there, but we weren't, consumers for the most part, were not aware of the NP, the NP degree or what that meant,
right,
and the important role that they have always played, but more so even today, because you're seeing more and more nurse practitioners as part of OBGYN teams.
right.
You're seeing the role of nurse practitioners in, even in the hospital that I work, a lot of them are delivering the babies too, and then have the degree as the nurse midwives too. And hopefully, fingers crossed, we're going to see more nurse midwives as part in hospital settings, because I know in New Jersey, that's still a hurdle for some of the hospital systems in our area. They will not cover nurse midwives to be there and doing the births. It's still OBGYN. So I think I love the fact that we're talking about this, talking about the important role that the nurse practitioner in women's health plays, but also the education that you have for women throughout the ages and stages of their lives. It's not just reproductive health.
Correct. It's not. It's totally, it's kind of different. And our training is a little different and I don't know should we not go into this now, or should I?
Yeah, go ahead. Let's just go. Yep.
Just go into it. Okay. So most patients, when they see a nurse practitioner, they're unaware, and it's not anybody's fault. They're just unaware. It's also, because we do not talk about the different types of nurse practitioners there are. And when I say we, I mean we as a profession in nursing and in nurse practitioner profession. So family nurse practitioners differ from women's health nurse practitioners, differ from acute care nurse practitioners in so many ways. And a family nurse practitioner can absolutely see pregnant patients, absolutely. However, their education and training is like more of an overview for obstetrics rather than a deep dive into obstetrics. And then also for high-risk pregnancies, they don't cover that really in their curriculum as well. For women's health nurse practitioners, it's really embedded in our curriculum, and obstetrics and high-risk pregnancy as well, and postpartum. So family nurse practitioners can get additional training. They can get on-the-job training. They can do additional certifications as well. So if you're seeing a family nurse practitioner in the obstetric setting, it doesn't mean it's wrong or anything. They don't know what they're doing. Of course they know what they're doing. They've just had additional training. A women's health nurse practitioner already has that fundamental training, and they don't need to undergo additional training in that regard to see an obstetric patient, even high-risk pregnancies as well. So that's really the main difference.
No, that's so important, and thank you for sharing that. I want to talk a little bit about your career in the Army and what you did in the Army, because we had the opportunity to talk a little bit before the show went live about some of the care that the Tri-Service provided for women that were antepartum, during pregnancy, and postpartum, that worked really well. So I would love to tease that out a little bit about what did you feel as your role when you were in the Army, of the soon-to-be moms and new moms, that worked really well to support them during this transition?
That's a great question. I will say that when I was in the Army, when I was active duty, I was not anywhere in women's health. I did trauma at that time, but I wasn't working as a Department of Defense civilian in the military healthcare setting. Most of my time with my advanced practice degree. And I will say the programs that the military healthcare system provides for and support, programming and support for pregnant individuals and postpartum individuals and new parents is actually phenomenal. So when they are, in the military healthcare, we do group prenatal care, which is predominantly administered by, or facilitated by, nurse practitioners and midwives primarily. And it's group prenatal care. And most patients, when they hear about it, they're like, oh, I don't want to do it. I don't want to be with other women, or I've already done this before. I don't need to do this. And I usually tell patients that's what it feels like, especially the first couple sessions. I mean, after session 3, 4, and 5, it's like getting a group of pregnant individuals together, and they are just having a coffee talk, and they're sharing stories, and they're also learning too. So as facilitators and providers, we also bring in like guest speakers. So I've had pediatricians come to talk about immunizations afterwards, and care and any exams that they might have to do afterwards. I've had Military One Source, which is a program that the military has. They have all these programs located under Military One Source, and one of the programs is a new parent support program. And in those new parent support programs, they have like baby boot camps, new parent programs. They have, baby fairs, all these things that are free programs for these new parents and support. I think with anybody, whether they're military or not, is carving out the time to go to these programs and do it. I think that's probably one of the largest barriers for anybody, whether you're military or not. And then and making sure that the times they offer is within, your time that you can go. But they're out there. And I think one of the biggest problems is dissemination of information, because there's high turnover, people come and go. So really getting the most accurate information out to our patients is, hard to do sometimes. But again, going back to what we call the Military One Source or New Parent Support Program, they are like the connector to all of these programs.
No, thank you so much for sharing that. And I feel even with these classes, you start like these support groups, like, natural support groups, because other soon-to-be parents are meeting each other before they have their baby, and then they kind of stick together after they have their baby. There's friendships that come up, and they bond, and So you're almost starting this like mini like support groups for new moms or soon to be moms. So I love that. And I always love sharing what's working, because I feel like, especially today, we always hear about what's not working. So it's sometimes it's just lovely to hear like, this is what I saw this in practice, and this is what's working, and it was really powerful. So thank you for sharing that. I want to jump in, and it like appeared yesterday on the news when I was, having my first cup of coffee yesterday. I noticed that a recent study came out by the CDC that reported a declining number of births in the United States, but it also shows that the percentage of women who didn't see OBGYNs while pregnant rose from 2022 to 2023. Why do you think, though, people are not seeking prenatal care? Why do you think that number is rising in the United States?
So I think that's multifactorial, and also that declining birth rate, right, in the U.S. And I think I think it was 1% it declined, or 2%, something like that. And then the rise in those not seeking prenatal care, I think, went up by it's like 5%, which is crazy, right? But it's not crazy when you think about it, of all the factors that play into this, right? So I think it's due to a number of reasons: economic factors, access issues, distrust and mistrust of the system, just all of that in totality, right? So the cost of living, housing, childcare, healthcare, could really discourage people from having children. Financial instability, policies related to family leave and parental leave, those haven't even been standardized in our nation yet, right? Even insurance, out-of-pocket costs for prenatal care, they can be significant. So some pregnant individuals may forego those regular visits because they don't want to pay the extra costs that they have to. And then that access issue, we know in the US, this is not new news about healthcare deserts, right? We know about healthcare deserts. And then also, in addition to the healthcare deserts, inside of those healthcare deserts, there's maternity care deserts. And most of those are in these rural areas because there's a shortage of OBGYNs and midwives and primary care providers in all of these areas. And it makes it difficult for a pregnant individual to access the services that can be provided. Policy, I'm a policy wonk. I love policy. And I will say everything I feel really boils down to policy. So, for instance, HRSA, which is the Health Resources Services Administration, that is our primary federal agency for improving access for healthcare service for people who are uninsured and isolated or medically vulnerable. So they don't recognize women's health nurse practitioners, which is what I am, right, as an obstetric provider. So they don't fund women's health nurse practitioners to work in these maternal healthcare deserts. So they will fund obstetricians, they will fund midwives, certified nurse midwives, and family medicine folks that regularly practice obstetrics. And the reason why I bring that up is because, again, we're seeing obstetrics and pregnant individuals, we're siloing healthcare. So instead of using everybody to their fullest extent, we're only funding people that are just delivering babies, right? But if you think about it, in these rural healthcare areas, there are social, structural, institutional racism and determinants of health that really affect their health, right? So they're more than likely going to have higher risk pregnancies. So those who have higher risk pregnancies, they need more visits. And if you're only having an obstetrician and a midwife that's delivering your baby, seeing them in these areas, they're not going to have time to increase the visits from your once a month visit to weekly visits or twice weekly visits. Who's going to do those visits, right? So really looking at the larger picture, it all boils down for me to policy, but really making sure you're recognizing and utilizing the healthcare professionals you already have in the system to their fullest extent. So that's just like my plug, I feel, is one of the issues. that we have these declining birth rates, and also reason why people might not be seeking prenatal care. And then that misinformation and distrust, and especially during the COVID time period, it was very, very prevalent. I think that's still lingering, healthcare systems. And then we have, social and cultural factors, people delaying parenthood, societal pressures. Those are just some of the reasons I think that are kind of interplaying this.
No, I couldn't agree more. So how can we help shift that? How can we help shift HRSA to start covering and accepting nurse practitioners in women's health as primary care providers instead of siloing? Because it's gonna get worse before it gets better. That's my biggest concern. And so as we see more and more urgent care centers popping up, more and more people using, especially in the rural areas, Walmart as an example, for their primary care, and soon I'm sure for maternity care, and especially, and I'm thinking about rural areas, but again, I'm in New Jersey and I'm seeing a lot of OBGYNs retiring from OB, right? So it's not as easy to find even an OB that will take new patients because they're so backed up. So can you talk about what can we do to help change this? What's needed?
So I will say HRSA does recognize women's health nurse practitioners as primary care providers in these healthcare deserts. And I do want to put a distinction between healthcare deserts and then these like maternal healthcare deserts that are embedded in these healthcare deserts. So women's health NPs can do primary care in these healthcare deserts. They're just not going to be funded really in these maternal healthcare deserts, right? So, but again, it's that piecemealing and siloing healthcare, and how do we change that? I do think there has to be a legislative change for that. Introducing some bill or addendum to that. I do think it's a bigger fight, I feel like, to do that. I did have a meeting with HRSA, and they do recognize, they're like, oh, wow, yeah. But I do think it is probably more so of a legislative change that has to occur for that. And that is a bigger bite to take on, for sure. So I think that's one of it, but also bringing awareness, right? This is the whole point of this podcast and the series, is bringing awareness. What is a women's health nurse practitioner? What can we do? And how do we care for our communities utilizing women's health nurse practitioners to their fullest extent? Because we're out there. It's just not as well known.
So to wrap up our conversation, which I just trust me, I'm going to bring you back for a conversation just on policy, but let's talk about, just to inform our audience, nurse practitioners can take care of you from your, as early as what?
So
women's health nurse practitioner. Yep.
So like from adolescence all the way on into, well into, in your postmenopausal years. So, and then it's not just pregnancy, right? So we know that you're pregnant, is the average, right? Pregnant individual remains pregnant for about, 3 years of their life, right? On average in the US. So, beyond that, there's so much more. There's, as you guys have been talking about menopause, and we have osteoporosis, right? The rates of that have increased, right? So these are things we really need to make sure that we are caring for women. For me, it's cardiovascular disease. I'm really big on prevention of cardiovascular disease, and really making sure that women know the risks associated with that. So, I think it's really the whole health of the woman. We really need to make sure that we are making sure we're optimizing everyone's health, especially if they decide to move on into pregnancy, optimizing their health before, during, and after pregnancy as well. And then beyond, especially in the menopause, perimenopause, especially, We're getting great data on perimenopause right now and how we can help and the symptoms for that, and then postmenopausal. So there are just so many things we can do as a women's health nurse practitioner, and just making sure that the public is aware of the differences between the types of women's health, or types of nurse practitioners.
No, perfectly. You wrapped it up. Thank you, Kwuan, for leading us through such an important conversation today on the role nurse practitioners play in women's health, particularly maternal care. And thank you to all of our audience for tuning in today for this episode of Women Talk. For more information on this topic, please visit us at healthywomen.org and tune in for our next episode in the series on nurse practitioners and menopause. Thank you again.
Thank you.
Thanks for joining us for another episode of Women Talk. Stay tuned for more Healthy Women Live events at www.healthywomen.org. You can also follow us at Healthy Women on Facebook, Twitter, YouTube, or LinkedIn, or follow us on Instagram at healthywomen.org. We'll see you next time.